Good evening, I'm Rachel Hartog. Today, Union Hospital in Terre Haute unveiled its newly renovated mother-baby unit in response to increasing birth rates in the area. The new space has room for 30 mother-baby couplets, which is double its prior capacity. The unit combines nursing care units for mothers and babies that were prior to the opening separated between a postpartum section for mothers and nursery care for newborns. Mother-baby couplets now stay and sleep together. Indiana University nursing professor Desiree Hensel says centers like Union Hospitals reflect a directive from the World Health Organization to keep mothers and babies together for 23 hours a day immediately after birth. And starting May 1st, part-time employees in Bartholomew County government will be barred from working more than 28 hours a week. As WTIU Stan Jastrzebski reports, the county commissioners approved the measure today after making a few exceptions to the rule.
Under the Affordable Care Act, employers with 50 or more employees are required to provide health insurance to all employees working more than 30 hours a week. But Commissioners Chairman Carl Linnup says that's unrealistic for the county's budget. Though there was no public comment for or against the ordinance during Monday's meeting, Sheriff's Department Chief Deputy Todd Noblett noted many new jail employees are required to attend a 40-hour training session. Linnup says small, short-term exceptions to the rule are okay, so long as employers pay overtime.
There are going to be some exceptions, and while we cannot, and we're talking about probably a total pool of almost 40 part-time employees for Bartholomew County, I think the public realizes, and we realize, that there's no way we can take all 40 of those employees and grant them health insurance.
Commissioner Larry Kleinhens noted during the meeting the county may soon receive between 3 and 5 requests to make part-time employees full-time as a result of the ordinance. For WTIU News, I'm Stan Jastrzebski.
And in response to continued troop withdrawals from Afghanistan and other parts of the Middle East, Camp Atterbury is changing its role. In recent years, the base has been used to train troops for overseas tours, but as WTIU's Noelle Visser reports, the camp is now moving toward reserve training and cybersecurity testing.
For the past 10 years, Camp Atterbury has trained soldiers for deployment in Iraq and Afghanistan. But Camp Atterbury-Muscatatuck Colonel Ivan Denton says the base will now become more of a problem-solving center for technology than a training ground. That includes working the UAS, unmanned aerial systems, also known as drones.
What's changed then since 911 is significant homeland security problems that have to be solved, significant cyber problems that have to be solved, significant UAS problems that have to be solved. So we're in the problem-solving business, and we certainly hope to be able to support some Department of Defense or Department of Army agencies support those 3 problem sets.
The base is also changing its name to Atterbury-Muscatatuck. Denton says that's because Camp Atterbury and the Muscatatuck Urban Training Complex, a base about 50 miles southeast of Atterbury, will become more integrated both in staffing and in their missions. Denton says the facilities will continue to be used for emergency training exercises.
And last August, we had 10,000 soldiers, contractors, role players to just support an unbelievable exercise where we did over 100 venues at Muscatatuck, just world-class training. So I see that as absolutely, we would like to do about 10 of those huge events per year.
Still, Camp Atterbury-Muscatatuck will maintain some of its war training roles as it prepares soldiers for the reserves and could be used to train troops before deployment if needed. For WTIU News, I'm Noelle Visser.
Here's a look at the weather tonight. Clear with lows at around 25. Tomorrow mostly sunny with high around 49. Tomorrow night mostly clear with low around 33. Wednesday mostly sunny with high around 49 and low around 31. For WTIU News, I'm Rachel Hartog.